many health conditions. So a lot of terminology that you'll be hearing today, I know that I think Dr. Leonard facilitates at their IFM program, the Institute of Functional Medicine. That's something that I use in my practice when I see my clients as well. So I help people to lose weight, help people manage stress, diabetes, all these kinds of conditions I think primarily are influenced by lifestyle. So how you move, getting adjustments, I think what you eat, all these factors really determine the expression of some of these conditions.
Okay, we have Dr. Oscar Hernandez has been practicing internal medicine for
20 years.
20 years?
I'm 25. You said 25.
I thought it was 25.
22.
Okay.
But I don't want to be that old.
Got it, got it.
Okay, my name is Oscar Hernandez. We run a internal medicine and pediatric practice right near Kendall Regional Airport, right across the street there on 120, where on the other side is 137 and 120. And we've been there for about, we've been in the neighborhood for about 22 years. We moved in there about 2 years ago. So I take care of children, I take care of grown-ups, and I'm, if he's a grunt chiropractor, I'm like a grunt family practitioner. So we also do weight loss programs, and that's it. That's what we do. So that's my perspective. I'm just a plain old doc, plain old country doc.
Awesome, awesome. And we all know Dr. Sabater, right? Okay, and you want to say anything, Doc?
I've just been here in practice almost 6 years, actually.
Can't believe it. Sorry.
And basically, he got me out of the rap. I've been here with him, and I've loved the experience. I love seeing you guys. And it's really nice to see all the results when you guys follow through. Especially, I hope that you learn something with the nutritional recommendations, exercises. It's very important to keep an active lifestyle. A lot of us, sometimes we just get complacent and we just lay down and relax and just expect to be done in 2 seconds, but you also have to do your part. So hopefully we can give you some tools so that you can incorporate that in your lifestyle.
And of course, many of you know Dr. Smith, but some of you don't. And he's been a surgeon for many years, and he was involved at University of Miami. Dr. Smith, you can tell a little bit about yourself and background.
Yeah, I was on the faculty back in the 70s at University of Miami and helped run the ICU there and trauma surgery and a few other things. And then I went to private practice for 25 years and moved back to Miami 10 years ago. And I've been on the medical advisor for the University of Miami's integrated medical program for the last probably 6 or 7 years. And I'm pleased to say that we've got like 100 to 150 people now following that program. A lot of them are medical students, but there's faculty, residents, a lot of practitioners in the community. So this stuff we're talking about now is going to hit mainstream medicine. I speak to the third-year medical students almost every month, and I really put it to them that, you can be a surgeon, you can be a dermatologist, you can be whatever, but your patients know more about this sort of nutritional, supplemental, dietary, lifestyle medicine than you do, so you need to learn it. So I'm pleased to say it is getting through on a university level, and that's what I spend a good part of my time doing. And I do also private consultations, mostly on the phone, occasionally in person, but just try to help the person communicate, give them the right answers to ask their doctor, or if they even want me to, I'll talk to their doctor. So I do that sort of thing, and otherwise I try to go windsurfing with him or look out for my grandchildren.
All right, so Dr. Sabater, you can pose some of the questions. And
Sure. So basically I have some questions here that you have written. If you have any more questions, you can pass it down and we'll go over that. The first question I have is, when I sleep more than 8 hours or sideways, my lower back hurts, how can I prevent this? And also I have developed a skin dryness, redness. Would I be able to treat this through chiropractic treatments?
Okay, so that's the chiropractic. Okay, well, back pain when you sleep, typically, it's not uncommon for patients when they sit in a static position for a prolonged period of time to have swelling of a joint. And every joint in the body has an articular surface that the joint glides over. And what happens with a lot of folks due to sitting at a computer, for example, or driving in traffic, which we don't have much here in South Florida. What ends up happening is we end up having areas of the spine or articulations that don't glide like they're supposed to. So when I evaluate people, one of the things I like to look at is how you stand, how you hold yourself. And it's not uncommon for people to have a postural distortion with a dropped shoulder or a forward rib cage or head translation or the head forward or a pelvic imbalance, but also like to look at how you move. And it's not uncommon for people to have reduction in range of motion. So what ends up happening is if the joint doesn't fully glide over or roll over itself, that area of the joint starts to become a little fibrotic, and it starts to have a tendency to get inflammation. So tissues that lose elasticity tend to inflame because there's an interference with the fluid dynamics and the way fluid gets in and out of the joint. Now when you're sleeping at night, you're not moving the joint. During the day, you're moving the joint. It's not uncommon for people who have degenerative disease of a joint or osteoarthritis of the joint to have swelling in the morning when they wake up. And as you move, it feels a little better. Has anybody ever experienced that? It takes about an hour to get things going. And every joint has a capsule that surrounds it, and on the surface of that capsule of the joint, there's receptors. So when a joint is not moving, it tends to get a little bit larger. It tends to expand a little bit. And it tends to fire those receptors a signal to the brain, hey, watch out, be careful, I better not do something because I may tear that capsule, maybe create a little leak in the capsule, or create some more damage to the joint capsule. So as you move around and warm up, the joint starts moving a little bit better, the fluid dynamics into the joint improve, the capsule size goes down, and you feel a lot better. But in order to reduce that from happening, things like really assessing your mattress. Is your mattress appropriate? Do you need a new mattress? Perhaps the mattress needs to be flipped or rotated. If it's one that can be flipped or rotated, maybe reassessing the surface that you're sleeping on. Avoiding postures, for example, sleeping face down tends to cause a lot of problems with a lot of people because when you sleep face down, you have to rotate your head. When you rotate the head, this can create problems with the brachial plexus, which is a bundle of nerves that comes off the neck into the hands. So a lot of people will wake up with stiff tingling in the fingers or shoulder pain or stiffness. So you want to sleep preferably on your back or on your side. So on your back with the one pillow underneath your head, or on your side with a pillow between your knees to take stress off the hips. So those things are helpful. One pillow underneath the head too, because a lot of times people sleep with too many pillows underneath the head, end up having the forward weight bearing, and that forward weight bearing tends to load the spine more. Since your discs are on the front of the spine, so when you flex, most people, by the way, age in flexion, not extension. You ever see somebody get old like this? People don't get old like this. They get old in flexion. So flexion's a problem with most people. In fact, as a chiropractor, we're mostly adjusting your spine. I mean, in flexion, you notice we're putting you in flexion. I'm pushing you back. We're getting more extension into the spine. So flexion's a big issue. So you want to sleep with one pillow underneath your head. Anybody here a stomach sleeper? Side sleeper? Back sleeper? Anybody don't sleep at all? Okay, so you want to try to avoid sleeping in postures that put your spine in an out of neutral position. For example, they call it Saturday night palsy. You know why? You ever heard of Saturday night palsy? It's a condition. We'll learn that, Logan. I know. You get drunk, you go to sleep, and you fall asleep like this, and you wake up and you have, I can't feel my arm. That's Saturday night palsy. So you want to try something like that. So you want to try to sleep in a neutral posture. So when you're sleeping, so having one pillow underneath the head, a pillow between the knees. Another thing to get a better night's sleep, which I found to be helpful, is taking a touch of magnesium. And I found it to be really helpful just to calm muscle spindles down, help microcirculation, making sure you're hydrated. Really important for microcirculation and pH balance in your body. Leonard, you want to add anything to that? So chiropractically, make sure the joints are moving symmetrically. If you have good symmetrical spinal movement, patients are always amazed when I first evaluate them. I'm going up the spine, motioning in, and I'll find segments that are just moving fine, oh, blocked. So those segments that are locked are going to be the ones that have a tendency to get inflamed on you. So you want to have nice, good, symmetrical movement through the spine. So one of the things that we do when we palpate and evaluate is checking that symmetry of motion in the spine.
I want you to show him, because you showed me, he's definitely got me on the radar screen, because I spent 35 years doing surgery like this, and now on a computer like this. Show him where the computer's supposed to be with regard to where you are.
Right, yeah, well, the same thing with computer and texting as well,
Yeah.
even more so.
Yeah, right, because it's so easy.
You want to keep the ears.
You need to text up here.
And
Always look to heaven and see where you're going next.
Exactly, I like that. So when you text, you want to text with the head and extension. Here's the key: the spine optimally in a neck curve, according to chiropractic biophysics, which is I guess the most scientifically studied research technique in chiropractic, identified that if you picked up an anatomy book, any anatomy book, and looked at the spine in that book, you'll see that the spine from the front is straight and from the side it has curves. So we know that there's curves. Now we know that those curves should be in the neck, for example, 43 degrees. That's an optimal, functioning, efficient curvature. Most people are 0 or -5s. That's what I see all day long, and it's because we do this all day.
Even kids are getting that.
Even kids are having this. So what ends up happening is, as you front load the spine, you load the disc, and as you load the disc, you create a positive or a high pressure on the front of that disc. And inside a disc you have a gel called a nucleus. So that nucleus is going to go from, just like if I put a jelly donut in my hand and I did this to it, the gel's going to go that way. It's going to go from high pressure to low pressure. So as we create high pressure in the front of the spine, we create a situation where the nucleus tends to go back towards the cord or nerve roots, one of the two. So you want to do whatever you can to keep that load off the disc. We used to think that discs were like shock absorbers, and we find really they're not. They're really there to provide space between the bones. So you're keeping the architecture of the spine right.
So the second question was, I have developed a skin dryness or redness. Would I be able to improve this through chiropractic care?
That's a great question, and there's two answers. I'm gonna let Leonard answer. Let Dr. Smith answer the second part. As a chiropractor, really philosophically, and chiropractic is part philosophy, is not a treatment for symptoms or diseases or conditions. And as a chiropractor, I really wouldn't. Now, if you have dry skin, would I say you need chiropractic? Well, if I find imbalances in your spine, yeah, but not to treat your dry skin, to make your body function better. Now, in saying that, there's quite a few patients that I've seen in the past that have improvements with all kinds of crazy things. And they may say, well, chiropractic cured that. Not really. When the body functions better, many things take care of themselves. And I really give credit back to the power that God gave you. Your body has a tremendous ability to heal itself if you get it functioning better. It may be hydration, it may be chiropractic, it may be improvement of posture and relaxation of muscles, or a better quality of sleep because of that. But so chiropractic, when you attach chiropractic for a treatment of a disease or condition, I really think that's inaccurate, because as a chiropractor, we don't cure diseases. We work with just balancing your body so that in general, it's going to function with more ease and better function. If you want to add, now there's other things you could do function-wise to improve skin function.
Well, I think, first of all, make sure you're well hydrated, and most people aren't.
How much hydration?
Well, the general rule of thumb is about half your body weight in ounces of water, which for most people is 2 to 3 quarts a day. Now, you're not going to just belt that down, and you got to work your way up to it. But what I recommend is maybe get a half-gallon jug, or at least a quart jug, and take organic lemon, squeeze in there, maybe put a drop or two of stevia, call it lemonade, and just sip it throughout the day. But by the end of the day, make sure you've got close to 2 quarts in there. Not necessarily every day. The more you sweat, the more you need to do it. And the only other thing is make sure you're putting the right fats in your body, like the omega-3 oils and fish oil, which you can get from, you can buy the oils separately from different places like Vitamin Shock or Whole Foods, just high quality lemon flavored fish oil, extra virgin cold pressed olive oil, and coconut oil. I have a salad every day, and I take a little bit of all 3 of those and pour it on the salad to put it in the food, so I'm not taking capsules. But I think the oils are important, the hydration is important. What do you think?
Rashes have 1,000,001 reasons, right? Everything from a rattlesnake bit me to psychogenically induced rashes like neurodermatitis. I concur with his philosophy of not using chiropractic to treat a rash. Now, you might have a vitamin deficiency. You could have a rash from scurvy, and I see scurvy when I go to third world countries, which is a devastating illness. But rashes have 1,000,001 reasons. You have to look at the rash before you really can tell it. You could be all the way from having a bad thyroid to just being under a whole lot of stress, having a vitamin deficiency, having psoriasis. Rashes are tricky business. In fact, there's an entire subspecialty of medicine dedicated to rashes. It's called dermatology.
If it's wet, you dry it. If it's dry, you wet it. They get hurt and everything.
That's right. I put steroids on everything. See what happens.
That's the next question, actually. What is the purpose of cortisone shots if done repeatedly? Maybe the purpose on
The purpose of cortisone shots?
the purpose and possibly the side effects of
Well,
cortisone
usually
shots.
recurrent cortisone shots are used in rheumatology, or they're used by pain management specialists. And the concept is to strategically go with a needle and almost surgically direct a very potent anti-inflammatory substance into an area of pain, or that we believe inflammation is causing pain. It has its uses, but it can also have a lot of misuse, and it can certainly have terrible side effects on an ongoing basis. So steroids, whether you use them orally or you use them by injection, may have their place. They can be life-saving in a patient with rheumatoid arthritis, with acute pericarditis, all kinds of things. We use it for asthma patients all the time to help avoid chronic and recurrent asthma. But it's in a very select group of people. People who get recurrent steroid shots into articulations and joints can often have atrophy of the synovium and wind up having more problems than not. So there are plenty of side effects to steroids, whether oral or by injection, and when they're by injection, I generally encourage the specialist that I send people to inject to avoid more than 4 injections, because after that, it can cause other problems.
The point I think that's really good is that, you know, our acute care, when I lecture, and I do all over the country from time to time, the way I get people's attention, I say America, USA has the worst healthcare system in the world, but we have a great sickness care system. And the more acutely sick you are, the better the hospital-based, pharmaceutical-based formulas will work. And like he's saying, cortisol can be life-saving. Even in the oral, like the Depot-Medrol dose pack, when you had an allergic reaction or something's itching and just driving you nuts, you take like, 40 milligrams, and then 30, then 20, then 10, then 5, and you're done with it. But that can be a tremendous reliever of the problem. And so many of our medicines work beautifully on a short term. Just like the antibiotics, I've gone from the recommended 10 days to 2 weeks. I frequently look at people at 3 days, and if they're better, I'll think about stopping it, but letting them know if any recurrent symptoms, maybe we need to put them back on. But, and by and large, knock on wood, most people don't need more than 3 or 4 days. And when you go out to 10, that's when you've knocked the gut flora down, and now you've got a problem with diarrhea that's something nobody really wants to deal with. So same thing with steroids. They're absolutely wonderful. And this is how I'm trying to teach the students and let them know, you know, you want to have 2 tool bags. One's the acute medicine tool bag. They'll think you're a complete genius because doctors using modern pharmaceuticals can get people feeling better like that. So now you got their attention, but then you have them come back and say, now you got to be now I'm the health coach. We're going to talk seriously about diet, lifestyle, sleep, elimination, possibly detoxification, things that you may not have the time and resources to want to do. Let's start with baby steps and let's work our way up and see how much you can do. And I used to do it all the time. They do fine for a while. They get off the program, come back in, say, okay, I get off the program. I give myself an anti-inflammatory, but I know you use your body as a feedback mechanism. If things are going well, they're going well. If they're not, be intellectually honest. What am I eating? What am I drinking? How late am I staying up? Am I over-exercising, under-exercising? Over-exercising is worse. Under-exercising is next worst. The right amount is what everybody needs to do.
Okay, so the next question is, what does laser treatment do? And who should be getting laser treatments? I can probably help with that question.
Yeah, go ahead, do it.
We have here laser class 4, okay? Not everybody, needs it. And basically, the class 4 is a hot laser. The reason why we use the class 4 is to decrease inflammation, spasm, and pain. There's a cold laser. Cold laser sometimes is used for fungal infections, okay, for toenails, but we don't have that in the office. Basically, we have people with either stenosis, radiculitis, numbness or tingling in the legs. Sometimes we do that, or in the extremities, shoulders, pains. Basically, laser is a non-invasive technique that we can do it before you have to go into the cortisone shot. I don't know if you want to add anything.
No, really, and laser actually helps the cells release more ADPs, which help reduce inflammation and enhance tissue repair. And it's been very effective. I mean, I've had patients, that one gentleman, I don't know if he's here, on Friday, he was in so much pain, I felt so bad, and I know his insurance didn't cover it. I go, come over, let's see a little laser out here. And he was happy, he's like, "Can I go, oh man, he saved my weekend." But the laser works wonderful, and it really surprises me. The reason why I even got the laser is because I was at a convention, and I've had a little bit of bicipital tendonitis for years from pumping and sale. and it's always been there. I've always, done all kinds of techniques, some acupuncture, some Graston, and you name it. It always was there, and I was at the convention, the guy goes, "Anything bothering, any tendonitis?" And I go, I thought for a while, "Oh yeah, you have a little bicep thing here." 4 minutes, and it never bothered me again. I was like, "Oh man, I gotta get one of those gadgets." So that's why I have the laser.
Animals now are getting laser for horses and dogs. They're veterinarians.
Well, some of our vet patients or vets, they come in, and this one came in, and he goes, "I have the same laser, I use it on animals, it works great."
So you're saying you think it maybe increases the activity of production of ATP?
Correct, yeah, the class 4.
And you know what else is very interesting about ATP, and this is beyond what we're doing here, but you realize ATP in an area of inflammation will go to ADP, to AMP, to adenosine, and all of those as it steps down are helping to try to flatten out the inflammation. So ATP isn't just about energy, it is a natural anti-inflammatory if it's stimulated the right way, which our body tends to try to do anyway.
You know, I tell patients inflammation is kind of like a double-edged sword, especially after injury. We have a tendency I want the pain gone right now. And from what I understand, inflammation is kind of like it triggers the laying down of collagen tissue. So when we have a tear, let's say you fall off a skateboard, you tear muscles apart, they're going to heal together. To me, chiropractically, one thing that goes through my mind with patients is, how are you going to be downriver? What are you going to be like downriver? What's the quality of the scar that's left behind? And so many people, as they're healing, heal with poor mobility, heal with maybe not enough inflammation, maybe too much inflammation. And what ends up happening is the quality of that scar tissue is poor. It's not elastic, it doesn't have good collagen fibers that adhere together, and it creates a chronic inflammatory issue with people. And I've seen patients who've had trauma of some sort, and later on in life they have permanent restriction of motion, and they're always in pain.
The next question I have here also is on inflammation, which is arthritis. If one has arthritis, can it ever be healed? How about it if you have it in your fingers?
It depends. Take it away, Ray.
Well, just in terms of lifestyle, I think there are a lot of things that you can do to manage inflammation. First and foremost, diet. I think you can eat in a very anti-inflammatory way, as Dr. Smith was speaking about before. Some of the oils are very important, like the omega-3 oils, for instance. Also, avoiding things like refined sugar. A lot of sugar contributes to inflammation, also contributes to the formation of what are called AGEs, advanced glycation end products. Very technical, don't worry about what that means, but basically it does damage on a cellular level throughout the whole body, so it contributes to inflammation. Also, relaxing. You know, I think especially in America, most Americans don't spend enough time to actively do something to promote relaxation, and that also promotes a very strong healing response in your body. So taking time to do that. Getting sun exposure. Going back to the first question about sleep. If you're not out in the sun during the day, your circadian rhythms are going to be off, and you're probably going to have difficulty sleeping. So making sure that you're getting some time outside where you're actually seeing the sun and it's going through the retinas. Also vitamin D, very strong anti-inflammatory. Mostly you get that from the sun, again. So there are many lifestyle factors that contribute to inflammation, and food toxins or food allergies that can contribute also to an immune response, and responses that not only give you symptoms like the arthritis, but also contribute to other symptoms that you may have. So avoiding foods and learning about the foods that just for your body are not compatible is also an important step in this.
You want to add anything to that?
What was the question again?
If one has arthritis, can it ever be healed? How about it if you have it in your fingers?
Well, some arthritis is just the wear and tear of the ages, right? And that generally is not curable, although it can be relieved by many things. Rheumatoid arthritis is a totally different animal. So rheumatoid arthritis is a chronic inflammatory state where the body's attacking not only its joints but many other tissues. When we usually talk about arthritis in the hands, most people are concerned about these joints here, these types of joints. Not necessarily these joints, but the distal joints. And those are often wear and tear, and you can see as you get a little older that you start to get little bumps and things on your articulations, and that's not that uncommon. But let me tell you, a lot of people that I see with arthritis, what they have is arthritis of the hip, of the back, and of the knee. And arthritis just means the swelling of an articulation of a joint. And many of these folks are just overweight. And so we know that obesity in itself is an inflammatory state because cytokines and interleukins go up in patients who are obese. Fat is a tremendous endocrine tissue. It produces all kinds of hormonal things in the body. So I see a lot of folks who are very overweight, and as they lose the weight, their inflammatory substances go down. And of course, the load from the weight that they have on the knees, on the hips, is a whole lot better. I have an 82-year-old lady who went from 190 to 140. It took her about a 5-month period of time. She was set up to get a knee replacement. Well, she's 82. She's not going to be an Olympic athlete. She wound up not getting a knee replacement because she's feeling good enough for what she does with what she has. So if you've got arthritic changes, swelling or pain in your joints, on weight-bearing joints, and you're overweight, think about weight loss. Medications may be useful, but it's back to the yin and yang. Now, when it comes to osteoarthritic or arthritic changes of the spine, I give them his card.
Now, I have a question here which follows through that. Explain when is it that surgery is the only answer?
For arthritis?
That's
And
surgeon
in
there.
general, when is it that, explain when surgery is the only answer?
Well, I guess if you've really lost enough cartilage, it didn't regenerate, or you got a frozen joint already, and you really want to have more mobility, that's when either partial or total knee replacement is good. But way upstream for that, just like you're saying, if you eat the right diet, if you do a moderate amount of exercise, make sure your vitamin, the two tests that you could probably get through Dr. D here one way or the other is a vitamin D blood test. Make sure the magic number is at least 40 to 50. Most people are walking around with 30, 35. A lot of doctors say 35 is okay, but I think the integrative doctors say 50 to 60 is even better. But that's even getting complicated, as I was telling Carl, because now we know you can have variations in your vitamin D receptor, which means that if your dose is 50 and you're 60 and you're still not getting benefit, if you have a variation in that receptor, they may be able to push you up to 60, 70, or 80, and you've got to be followed by a doctor in order to get enough vitamin D in the cell to actually do what it's supposed to do. So we're still learning about it, but it can be incredibly complex, but very simply put, everybody ought to get a baseline vitamin D and probably be supplementing on vitamin D unless you know that between 11 and 2 every day you can get in the sun for 20, 30 minutes and you're under 70. If you can do that, you might make enough vitamin D.
And not wash it off.
Yeah, well, that's another thing.
And
to do.
also get the other
They
fat
say the best
vitamins
part
that work
is,
synergistically with vitamin D. Like
it's
vitamin
called the
K2.
crotch armpit bath, because if you've been out in the sun, there is some data to suggest that you can, with soap and water, wash it off. I don't know if it's been 100% proven or not, but vitamin D is a real important test for any inflammation. And whether you're talking about rheumatoid arthritis or autoimmune thyroiditis, it's still all based on inflammation, and a lot of it is autoimmune, which means your own body is attacking itself. So the vitamin D is critical for that. The fish oil is critical for that, and there's a very simple finger stick test you can get done that you can set up here. It's called Omega Quant, where you find out what's the omega-3 index, which is what is the percentage of the fats in your red blood cell membrane, what percentage is the EPA and DHA, because those are the most important pieces. You don't need to remember any of that. What you want to remember, the number needs to be greater than 4%, probably 8 to 12% is ideal. If it's under 4%, if you're overweight and you're over 50, you're potentially set up for having a cardiovascular event, either stroke or heart attack. So that's why it's so important to make sure it's over 4%, ideally 8%. And you can do it just by taking fish oil capsules. It's fine to eat fish, but the problem with eating fish, a lot of them have too much mercury. I think the sardines, anchovies are fine. Some people say wild salmon's fine. Smaller fish, the smaller the fish, the better, like little yellowtail or hogfish are fine. Things like tuna, king mackerel, wahoo even, shark, all the big fish.
Tile fish.
Is tile high in mercury?
I think so.
And that's not even that big, so I don't know. To me, eat it in moderation, but that's another thing you can do. We've got a test, Damian has a test here that you can do a challenge test and find out how high your mercury is. If it's really high, then we need to talk about how to gradually lower it safely in your body. And you may have to do it for a long time, but it's just another one of those things that's been proven to be a trigger for inflammation. You can do a non-challenge test just by sending in a tube of blood, and they look at the red blood cell level of mercury, lead, cadmium, and arsenic. And if they're elevated, if it's in the red blood cells, the reason we like to do the red blood cell testing now, also for things like magnesium and selenium and copper and zinc, because that gives about a 3-month snapshot of what's been going on in your body for 3 months. Now, typically, standard medicine does that with blood sugar. They measure the hemoglobin, it's called hemoglobin A1C in your red cells, because if that number is high, it means your blood sugar's been high enough, you're coating your red blood cells have too much sugar in them. But it lets you know this isn't like just happened this week. This has been going on for at least 3 months. So it's a bigger snapshot and it gives you a better picture. So those are easy tests to order. And you can get for both, you can get for the toxic metals, and if lead and mercury are high in your red blood cell, you can assume they're high in pretty much your body. And the same thing, if your selenium and zinc are low, selenium and zinc are totally critical for all your enzyme pathways and to get the toxins out of your body. And frequently, if the toxins are high, the magnesium, zinc, and selenium would be lower. Not necessarily, but they can be. But these are fixes, and then you wait 3 months, 2-3 times a year, recheck it, see how you do. These are simple solutions to doing what I call preventive maintenance before you really become a train wreck.
Now, can you have a tear and be healed without surgery?
You know, that question is kind of vague. It's a little bit of what kind of tear, would it depend? You know, some patients, you know, with surgery, I'm not a surgeon, I don't give surgical opinions, but if I suspect any, hey Judge, if I suspect any instability, like if I do it, let's say it's a trauma person that comes in our office, we'll typically do stress views. We'll do views where we put the spine in a stress position or the segment into stress. I had a dislocated shoulder or suspect, or an AC separation. I want to see if there was instability, so I'll have the patient hold his 15-pound weight while I take the image and see how much separation there is. And if I see there's a tear where there's instability, I have to send them out for a surgical opinion. I don't give that surgical opinion, but if I suspect an instability of a segment, especially a spine, if I see this, if I do a lateral view of the neck in a flexion mode, and I see what's called stair stepping, where the vertebra actually stair steps forward, it could indicate that there's a ligamentous disruption, and that's something that would indicate that there's instability, and it would require a surgical opinion on that.
The minor tears, like a minor rotator cuff tear, definitely can heal on its own.
Yeah.
But now, orthopedists all over this country, not all of them, but there's one I know right up in Boca, will literally take some of your fat out of your abdomen, spin out stem cells, and inject them in the injury. And there's a very famous one of the New York Yankee pitchers had a chronic tear and was his pitching arm. He went and got it done, and 3 months later, he's back pitching. So the future is in somehow or another using your own stem cells or even stem cells from healthy baby donors. The mesenchymal stem cells are the ones you want. But that's something you need to look into before you just jump into it, because I'm sure there's a lot of people playing with it that probably shouldn't be.
Well, let me add a word about vitamin D. We do vitamin D testing all the time on our patients. Every new patient that comes in gets a vitamin D test. We do it as part of the cholesterol, lipid panel, the whole thing. We just add vitamin D in there. Everybody's vitamin D is low. And I tell patients to use vitamin D, and I tell them how much to use. And I see them 3 months later, and they stopped using their vitamin D because they feel fine, all right? So we know that low vitamin D is linked to cancer of the breast, to coronary artery disease, to CHF, to all kinds of stuff, all kinds of tumors and cancers. So if you're advised to take vitamin D, milk is not going to be enough, and yogurt is not going to be enough. And by the time you got enough through those natural dairy products, you're going to put 50 pounds on. So it defeats the purpose. Vitamin D is like love. Supplementation is forever. Okay? So don't think that you're going to take it for a month or 2 months. Your doc goes back, you tell her, hey, your vitamin D looks good now. And by the way, good is 60 or 70. Not I crept over the mark of 30 and I'm 32 and man, I'm normal. No, you're not. You're a
The
train
range
wreck.
is 30 to
Okay.
100.
They want to know how much vitamin D supplementation they need to do.
By
It's like body weight,
prescription,
isn't it?
it's 50,000 units once a week, 50,000 units once a week. Most of the multivitamins have a very small amount of vitamin D. They come nowhere close to 50,000. 1,000 milligrams is another common non-prescription dose. You take it every day. But again, it's the level that tells the story. If your level is good, then good meaning in the 60s, then whatever you're taking is enough. The day you stop supplementing, unless you really are out in the sunshine and doing some of these other things that they've talked about, you're getting a couple of hours of sunshine every day, it's probably going to go down again. I heard at a conference once that 15 minutes of sunshine on your face, hands, and forearms every day is sufficient. I've never seen that work for anybody. Okay? So I don't think that 15 minutes is going to do anything except maybe save you some money at Geico.
And you're not going on your face anyway, because I'm a living proof of that after 60 years in Florida sun and on the beaches and surfing and windsurfing. I've got like basal cell cancers I'm dealing with, and I'm pretty much dealing with it topically. I've had a few removed, but the bottom line is, if you're gonna get it in the sun, by all means, please cover your face. And just like roasting a turkey or something, do 15 to 20 minutes on the front side, flip over 15 to 20 on the back. There's a book out there called The Vitamin D Solution. I'm sure you can get it on Amazon. It's by Dr. Michael Hollick, MD, PhD from Harvard. It's the most practical book I've ever seen about vitamin D. And he's exactly right. If there's only one thing you could do for your health care, is to get your vitamin D up to at least 60 and keep it there.
That's low-hanging fruit.
Do what?
That's some low-hanging fruit there.
Another question, I get up several times a night to pee, what can I do?
Watch your fluid intake.
How old are you?
I like my question.
What's your question?
No.
How much water or fluid are you consuming? And also be mindful of the diuretics that you're taking in. Things like caffeine, teas, all these things are going to promote you getting up at night and peeing. Also, your kidneys, how are your kidneys doing? So those would be things to investigate, I think. But the simplest thing would be just to say, consume most of your fluids before, 6 p.m. I think would be a reasonable time. Give yourself at least 3 hours before you go to bed, and don't drink anything 3 hours within your bedtime. I think that's the simplest explanation. And if you're drinking any kind of diuretics or anything like caffeine, you want to make sure that you eliminate those things or reduce them, especially as the day goes on.
What kind of pillow should I use to sleep?
That's actually, you don't want to sleep with that one. That's a general, that's for the neck, back, and extension. However, one that makes you comfortable. Your body's pretty smart. It'll tell you when you wake up, if you're sleeping with a good pillow. As a general rule of thumb, as long as your spine's in a fairly neutral position, you're probably gonna be okay. As long as you're not, creating an anterior weight bearing, your head's not cocked laterally, something that keeps you in a fairly neutral position is typically fine.
How can I alleviate my nose and ear clogs?